On behalf of Cambridge Healthtech Institute's Breakout COVID-19 Global Web Symposia series and our sponsor, Persistent Systems, I'd like to welcome you to the Embracing Telehealth and Virtual Care Delivery Post-COVID-19 presentation. My name is Heidi Brown, and I am the host and technical director for today's event. Now I'd like to introduce our moderator for today. He is Dean Douglas, Head Growth and Solutions, Salesforce Practice, Persistent Systems. Welcome, Dean. The webinar is yours.
Thank you, Heidi, and hello, everyone, and thank you for joining. As Heidi indicated, today we are going to be talking about embracing telehealth and virtual care delivery. We have two panelists with us. The first is Dr. Sindhu Pandit, who is a medical doctor, physician, and she's Salesforce's go-to-market leader in healthcare and life sciences. Good morning, Dr. Pandit.
Good morning, Dean. Thank you. Thank you for inviting me today. And thank you all that have joined today as we walk through some of the changes and challenges that have faced the healthcare industry.
Fantastic. The second that I'd like to introduce is Vinod Parale. He is our Associate Vice President from Persistent Systems. He leads our healthcare and life sciences division in Persistent. Good morning, Vinod.
Good morning, Dean. Good morning, everybody. Thank you for the introduction, and very happy to be here.
Thank you. So, Dr. Pandit, I wanted to turn it over to you, and just if you could kind of let the folks know on the phone or on the webinar what kind of topics you're going to be covering this morning.
Sure. So, as we were preparing for this webinar, we talked a lot about some of the fundamental shifts that we've seen in healthcare recently from the pandemic that's obviously very much on everyone's mind these days. It's hard to believe that the first confirmed case was just about 5 months ago, back in January. And at that time, we were just kicking off the year, possibly thinking about our digital strategy. At most hospital systems, it was being discussed, being planned for, maybe in a pilot phase. But for most, it was still a set of bullet points. Just in this time, we've seen even those systems that had already been using digital tools to see patients, and they were seeing high volumes, they've even experienced a 366% growth in virtual visits per a recent study. And even organizations pre-COVID that were participating in remote patient monitoring, they've seen a massive hike in utilization of those tools as well. In that time also, 72% patients have had their first virtual care visit. And they are looking to see that as a permanent option for them as they pursue their healthcare needs. So this is all very truly remarkable. And we're only seeing this continuing to evolve and change and adopt as we kind of evolve in this new normal. A lot of factors are at play here. Of course, initially, this was a lot about keeping patients safe and keeping staff, whether it was the clinical teams taking care of those patients and administrative staff supporting those clinical teams, keeping them safe to spread to minimize the spread of the virus, also create physical room. But in making this shift, we've quickly seen that many of the tasks and the visits that we required patients to come in for could actually be done very effectively remotely. It's not necessarily a new finding. It's just that the digital infrastructure was put up so rapidly in this time period that we could leverage this for delivering this care. And in addition to this, this is super important. The regulations around digital care delivery and telehealth services have started to change as well. And that's what's caused this exponential adoption to occur. And, I'm a part of the Salesforce Ohana. And in this time, we've also done our part in trying to support this. And it's been a learning process for all of us. In addition to coordinating procurement of PPE, personal protective equipment. In the acute time, we also offered Salesforce Cares, which was a set of solutions to sort of help these systems as they responded to the volume of calls that were coming in, and also all the tasks around this potential COVID diagnosis. And once a patient had the diagnosis, all the tasks that needed to be coordinated. How do you do that in this environment when you're not bringing patients in? So it was a set of solutions to help with that. But in doing so, we got a lot of lessons learned. So this is an evolution, this is a growth, but I think we all have a lot to learn from each other as we kind of transition into this next new normal.
Thank you. I appreciate that. Vinod, over to you for picking up on what Dr. Pandit said, and then adding, from the technical side of things, what do you see happening?
Absolutely, I agree with Dr. Pandit. We have been working with health systems for almost 8 to 9 years now. We have been implementing different technologies, including Salesforce as a primary technology for our health system, clients and providers. And in terms of COVID, I have similar kind of observation where health systems are kind of initially when COVID started, they were looking at adding some tool that will keep their general community at ease, because there was a lot of anxiety and anxiousness about I'm exposed, and they wanted to learn a little bit more about virus and situation and conditions. So from there, we have seen that health systems are adopting Salesforce as a platform, as a tool that they can extend to their existing systems. And then from there to recent times where now it is going into more like, how do I use this tool to extend virtual care? Because, we know that until vaccine is out, we are not going to see the patient, or providers are not going to see the patient. So how do I extend my existing systems using, tools like Salesforce? And how do I reach out to patient, not only from engagement standpoint, but also from care standpoint? That's where we are seeing the shift. And that's where we are seeing more and more conversations around that area, Dean. So very much aligned with Dr. Pandit's observations and comments.
Thank you both for those for the initial comments. We appreciate it. That kind of sets the stage for moving into more of a roundtable discussion, where we're going to let Dr. Pandit and Vinod kind of discuss back and forth. The first question that we have lined up is basically, what are some of, you've outlined the initial challenges, but what are some of the secondary challenges and impacts that we're seeing from COVID today that health systems are seeing? We know the primary, obviously, the crush of people, the lack of preparedness in some cases, but what are some of the secondary challenges that we're seeing? So Dr. Pandit, we'll start with you, and then you and Vinod can take it back and forth as you see fit.
Yeah, absolutely. So there are several things that are stressing the hospital system right now. I think we can all rattle off a long list. One of the biggest ones that I'm most concerned about, and just that really does require us all to pay attention to, is the behavioral impact that this is all having. Before the pandemic, the CDC had reported that 1 in 5 adults experience some form of mental illness each year. Now, in the midst of this pandemic, along with, we have a high unemployment rate, not to mention the stress on our frontline workers that was required. And I mean, even now with some of the regions going under the acute stress of the disease surge, or the surge in numbers. So the stress on our healthcare and other frontline workers, patients having to recover alone, given the visitation limitations in the hospitals, and the grieving that has been kind of jolted in this time frame. That, I mean, we've never had to grieve without our traditional social outlets. All of these are just stressing an already stressed system with regards to our behavioral health, our way to support behavioral health needs. I share this concern that many have shared, that we're going to see a mental health crisis that we have to kind of get ahead of. I think technology offers some tools to increase access, support engaging some patients in, and maybe facilitating better care coordination. We have to really think about preventative measures for our vulnerable populations and intervening in a timely manner so that we can offer support and guidance in these times. Vinod, what are you thinking?
Absolutely. I think, if you look at the timeline, then they, COVID started, and then as a result, they kind of pushed out elective procedures, and now, they are coming back. But as more and more states are reopening, we are seeing spike in cases. And as a result, we feel that, now electives are probably going to take a little bit back burner in a way, and priority is going to be treating those patients. And my observation is that, health systems are, feeling the pinch in terms of revenue and in terms of other elements to continue business as usual. And that's where they are seeing this as an option where they can look at, what other tools, what other elements that I can bring in so that patient doesn't have to, come to me, but I can reach out to patient and, more like a proactive care. So that's where, we are observing certain kind of discussions and those kind of things. So that is one part. The second very, very interesting and important part is because, doctors are not able to see non-COVID patients, it is kind of increasing a little bit of what they call care debt or care deficit, where because, cancer screening is, for example, not happening, and as a result, diagnosis is not happening. So, this is kind of a secondary challenge, as Dean was asking about, and secondary impact. So it's not only treating COVID patients, but it is kind of spreading in other areas, and it is kind of creating different kind of issues and challenges for health systems. And health systems are kind of looking at guidance in terms of, what they can do. And that's where, some of the discussions that we have been part of are kind of heading in that direction. So behavioral health is obviously, and as long as this is going to continue, longer it continues, basically, we are going to see more and more element of that. And imagine patient, who doesn't know what's going on, and there is no provider who can comfort her, then that is basically going to be bad situation from patient perspective. And health systems are trying to figure out like how to deal with this kind of challenge. So that's kind of my observation.
Thanks to both of you. Moving on to the next question. You guys were just leading right into it. With these secondary challenges, with the kind of offset, from the traditional aspect, as you see how we the COVID or a normal disease state would flow. How can technology help the systems right now? How can they help? What kind of technology, or how can technology help us actually deal with these challenges? Dr. Pandit?
Well, there was a rise in digital touch points or, utilization of wearables and other gadgets, if you will, by people, I mean, patient or otherwise, prior to the pandemic, and people were getting more and more interested in their own numbers, so to speak, their heart rate, their pulse ox. So it was definitely becoming more common in conversation on how to utilize this information. Now, of course, we're in a different era, and we have to think about how to utilize this information. Hospitals can certainly leverage technology to increase the overall value of care delivered by incorporating these data streams. I think a platform strategy is probably the most efficient way to create, to not just utilize these different streams of information, but to also then subsequently create a personalized journey for our people, or patients rather. So patients, members, and make it a people-centric system of delivery. So whether it's remote patient monitoring or intelligence built into care coordination, personalized engagement and personalized communication, I think hospital systems can deliver on that primary goal of patient-centric care. without compromising on efficiency, but rather gaining in those areas and increasing value. In addition, I think you're going to support clinicians in their workflows, optimizing their workflows by doing this. I mean, nothing against the fax machine. I was a big proponent of the fax machine when it came out, but it may be time to consider alternatives. Maybe eliminating the fax machine from the day-to-day tech stack of a doctor to improve the care they're trying to deliver to the patient, to make them more efficient and help them practice in a much more efficient way.
Yeah. I think the other part I wanted to kind of reflect a little bit around that, this is perfect time for health systems to kind of really adopt digital as a kind of channel to reach out to the patients. And, if you see like entire environment is kind of working towards that. So recently, government and private peers, they have kind of removed parity between televisit and, office visit. That is kind of, in my mind, that was like biggest barrier, and that is kind of out of our way. So this is very encouraging environment for health systems to look at digital technology and how they can utilize those technologies to do very, very smaller things, right? Or things that need not to be at scale, but smaller things like urgent care is one workflow where, obviously patient need urgent care, but can I initiate that, through digital channel, televisit, and telehealth kind of tools? That is like one element. Another element is like, how do I use self-triage? How do I use looking at, patient history? How do I use proactive care for those kind of patient situations? And then bucketing really patient groups and population, and then proactively reaching out to those patients. And that's where this technology really shines. And platform like Salesforce will really kind of make it quicker for you to kind of implement that kind of project from my perspective. Other element, Dr. Pandit, you touched upon is devices. So more and more we are seeing that there is great interest in within health systems to monitor their patients for chronic care and other elements, looking at very commonly used devices. You don't have to have like very specialized devices, like you can use smartwatches, phones, smartphones, just to kind of be in touch with the patient and really monitor that patient with consent, of course. But being there with the patient really matters, and I strongly believe that this technology will help health systems and providers to be with the patient, right, and really take care of those patients. That's what I think.
We have a quick question that may fit right now that came in from Scott. I wanted to find out, his question was, what role do the pharmaceutical companies have? We're talking about technology, we're talking primarily about health systems, but do you guys, either one of you or both of you, see a role or a change in role for the pharmaceutical industry, during this COVID crisis? And is there any technology maybe that they should be adopting?
Yeah, I can certainly comment on that. I think medication reconciliation is a huge area where pharmaceutical companies can help make an impact. They are interfacing often with the patient at the time of obtaining a prescription, and a lot of errors are made because we have disparate data systems feeding into a patient's medication record. And they, as with anything, we really should look at this as the ecosystem. I think anyone who has a role to play in the healthcare ecosystem has a role to play in this changing environment and to improve the overall delivery. I think we all can participate in making this a much more coordinated system. So absolutely, I think that, and then also helping patients with education and using, making sure education is personalized based on whether it's the health literacy of the patient or other components about the medications they're obtaining, so that we can be quicker to intervene on potential adverse events or side effects.
And just add a few more points here, or maybe one. Basically, these are very extraordinary times, right? And there is a possibility of different type of, partnership between provider and, pharmaceutical companies, as well as, pharma and peers for that matter. And that is like another possibility where you can bring in services and help patients, right, using these digital technologies. That's what I like wanted to highlight that, and I really see that this will end up creating different kind of business models, different kind of equations in entire healthcare ecosystem. Where these are like three pillars of this healthcare ecosystem, really, right? Provider, pharma, and payer, and they will come up with different kind of situation, different kind of solutions for this situation.
Yeah, actually, I would build on that, Vinod. You made a very good point. I think clinical trials are going to completely change in how we coordinate that. And I think, again, data is informing us in ways that we haven't. It's one thing to have the data. It's another thing to be able to act on the data. And I think that's what's changing right now in healthcare, is that capability to act on the data in real time. In clinical trials, to be able to kind of bring patients together into a community where we could get more insights on diseases and potential treatments in a much more timely manner. I think that's going to be a game changer.
Yeah, absolutely. Yeah.
So, I mean, taking that into consideration, obviously the data is living, but do you have other advice or other suggestions with the technology, not just the data, but maybe with the virtual care? How systems should go about deploying the front end part of it so that you get the right data on the back end. So, what recommendations do you have for health systems, both of you? Vinod, let's start with you on this one and let us know what your thoughts are in deploying these technologies.
Yeah, absolutely. So, there are certain kind of learning that we have had based on our engagement and this kind of initiative. So first thing is basically you need to put patient and provider experience at the center, and everything else is kind of secondary. So, many times, some of the health systems, they have very cluttered experience for patients. So if they have to do scheduling, they need to go to some other interface. If they want to kind of look at their medication, they need to go to another interface. So that is like one element where you need to really put patient at the center and really think about their journey with the health systems. So that is like one learning or one advice I have for audience here. The second is basically fine-tune your processes and workflows, keeping patient at the center, because you'll see that different kind of departments and divisions are interacting with the patient. And when you're looking at that, you're just looking at it from your perspective, right? You need to look at patient perspective and really see what it is that will, kind of help patient navigate, complex health system, right, from their perspective. So that is like the second element that I learned. The third element is you don't have to kind of rip apart whatever you already have in terms of technology or technical investments or technology investments. You can build on top, right? And nowadays you have technology like Salesforce, which can integrate with your existing, EMRs and other, systems that you have. And it becomes easier for you to kind of stand up something that will help you deliver virtual care, and basically serve the patient from experience as well as care standpoint. So those are the 3 points, Dean, that comes to my mind.
Yeah, I couldn't agree more. Vinod, you touched on something. It's always remembering that technology, everything we're talking about, these are all tools. These are all tools to deliver care, and healthcare is very personal. And it can go from being, routine, such as in the wellness space, to being something that's anxiety provoking, fear provoking, and just maybe changes up someone's life. So you make these shifts, and the system should be supporting someone through these changes, and they go in and out of being a person or a consumer to patient and a member, and that's the same person. So we need to be able to allow the technology solutions, whatever they are, to be scalable and to address the needs of the person consuming it or using it, not the other way around.
You both have already touched on kind of my next question, which is the considerations that, what do we do with, a new situation we're facing with COVID and the pandemic and all of the fallout and all the changes that the health systems are undergoing. but how do they, adapt that with the existing systems that they have? Do they need to replace them? I know Salesforce has, it is a very broad ecosystem. But what do health systems need to do? And we talked about integrating and things like that. So Vinod, if you could kind of guide us or give us your thoughts on, you mentioned process, you mentioned adapting, existing technologies with new technologies. So what's the thought there that you guys may have on, what health systems need to do systemically?
Yeah, sure. So let's look at what really we are trying to do, right? So we want to, stay with patient, before, during, and after care, so that we can really address patient as a whole. And in order for you to do that, you need different kind of elements, from technology standpoint. We literally need something like a Swiss knife, if I can draw that kind of analogy, where you can bring tool that will help you reach out to the patient, during, care, and really understand what patient is going through. If you take example of oncology patient, that is, they have like longer journey with health systems. So they go through initial diagnosis to, treatment, surgery if required, and chemos and those kind of elements. And then over there, you really need to have, technology that will help you connect with that patient in this longer journey. And then while you are doing that, as I said before, you don't want to kind of rip apart whatever you already have, and you want to build on top of that, right? So you need some element that will look at your data, across different encounters, and really deduce what this patient is going to need and anticipate their need. And then, based on that, you reach out to the patient. And then for that, you need different type of technology. If you take another example, like, reminders, like on their checkups or labs and other kind of elements, you need different type of technology. So what I'm trying to, say here is basically you need literally a Swiss knife that will help you, drive this engagement, drive this care delivery. And it's not just, one kind of one-off end-to-end or point solution, right? And that's where I believe that Salesforce as a platform really fits well, where you have different elements and different features that will help you deliver these different kind of elements that are required to engage patients and deliver care for the patient. Elements that you need is basically something that you can deploy quickly, and it doesn't take like months and years to kind of build something great, right? Something that you can deploy immediately. So that is one very important factor. Second important factor is something that is very easy to connect to your existing systems like EMR, pharmacy system, and then imaging system, and so on and so forth. So that is like second characteristic that I would look for in that will help you really understand patient interaction and basically reach out to the patient and really have this proactive care for the patient and using various channels. So third or fourth element is omnichannel, right? So nowadays people are not going to sit in front of their computer. They would need flexibility of getting care on the go in a way, right? So you need to have a platform and tool set and technology that is really omnichannel, that really understands the patient, that can connect to your existing systems, and then help you deliver that kind of care using these kind of initiatives, digital initiatives. And that's where I really admire Salesforce and kind of features that are there in suite of Salesforce platform that we can bring to the bear when it comes to considering all these different type of technology elements that you need for these kind of projects.
Yeah, I mean, I would echo actually everything Vinod said. The way I look at this, there's three trends that are showing up in all of these solutions. Remaining personal in your care delivery, so personalized care. So that's everything from communication to, as Vinod said, like task management. Being able to deliver care outside of the traditional setting of a hospital. And we've seen a lot of that happen with the utilization of the tool of telehealth, and population health, being able to look at other sources of data to help either with predictive analytics or kind of overall care management in a community. And that'll just allow for more powered and informed decisions at the population level. So as we are considering these solutions, if we all keep patient-centric and population-centric goals in mind, the tools should be scalable and dynamic to meet those needs for the population that a system serves. And so to Vinod's point, like it's not a out of the box and set it up and you're done. It's going to be an evolution. And there's going to be more tools that are out there that consumers are going to take and embrace, that we should be able to take on the data stream that creates in order to continue to inform these decisions we're making for our patients. So I think we're just at the beginning of this. I think the biggest thing will be to find something that's dynamic and scalable, and not a point of care solution. It's more of a larger, looking at the larger ecosystem and how we're going to all participate and getting a better value in the care, better valued care.
We have a question that came in from Ina, and it really is related to the topic you're talking about, and it is about scale. And the question is, how long does it take generally to scale the current technology to meet the needs of what we're seeing now? How long a time do we need to scale that in the current scenario? And, is the market prepared? So it's kind of a twofold question. So I know you're getting a 2-for-1 here. But is the market actually prepared to be able to scale this way right now? Dr. Pandit?
That's a hard question to answer. I mean, we're under quite a bit of stress at the moment. And so I think there's a lot of scale we've witnessed in ways we didn't know we could do. And that's, the way we responded to needs in different communities with regards to the pandemic. I think with the right infrastructure being set up, we should figure out ways to continue that momentum or build on that momentum. Having said that, I keep coming back to the ecosystem. I don't think this is going to be just hospital systems or just payers or just med device, just pharma. Everyone has to be thinking as a player in a larger ecosystem in order to get the true scale that we need to see. Because we can't live in this current arena of disparate systems and anticipate that we're going to get the exponential or to be able to leverage the data in the level that we want to. So I think, Vinod, you might be able to give more color to actual timeframes, but for me, I think we need to take this moment of I live in New Orleans, and we have and many have this saying that you don't let a crisis go wasted. And obviously here we had a pretty big crisis and learned a lot from it. And that's kind of how I see this time. I feel like we need to really step back and figure out what is the better way to move forward, not just to move forward. And so as far as a time frame, I'm not sure I can give that, but I do think that we need to step back and look at this as an ecosystem solution, or a solution for the ecosystem, not just an individual player in the market.
Yeah, absolutely. And I'll just add to, a couple more comments there. Very interesting question, So if you look at, from technology perspective, technology is becoming more and more kind of commodity, if you will. And then there is like this whole notion about cloud and, extensibility and scalability can be achieved. So cloud was really, not so welcoming word in healthcare before pandemic, but now everybody has realized that, SaaS is the way to go, and you don't need to kind of, have servers and technology in your basement all the time, right? So like I see the shift clearly where health systems, in general, they're cautiously moving forward towards, scalable element from technology standpoint. And that's where I believe, all of this will come together from a healthcare standpoint, healthcare as a ecosystem standpoint, right? So is technology ready for that kind of scale? I would say yes. Is health system and when I say health system, it is not only provider, but healthcare ecosystem. Are they looking at, scalable technology? Yes. Is there hesitation? Yes. But I think eventually this will go away as, health systems start feeling that, this technology is not, bad, or this is really compliant and then secure and way to kind of, scale your operations. So that is first part of the question. The second part is how the market is ready or prepared for digital technology. As I said, yes. Now, before pandemic, it was more like an innovative project where you want to kind of have, nice mobile app, or, a CRM project where you not want to understand patient better and deliver care remotely. But now it has become necessity, right? So these are like extraordinary times for everybody, including providers in my mind, and leaders, who are operating these health systems. And they're thinking about all these different avenues because, as I said, this situation is going to continue for, I don't have crystal ball, but in a way, maybe for a year or year plus. And this is, very good opportunity for health systems to adopt digital and really scale their operations. And I really feel that, health systems are going to compete with each other on patient experience and how proactively they're delivering care and taking care of their patient population. And that's where I see, all of this journey is going. And then slowly, healthcare ecosystem is also kind of waking up to this new reality, and they're kind of adopting with open heart in a way, right? So that's my observation, Dean and Dr. Pandit.
Forgive me, I was talking on mute. There's a couple more questions that have come up, and I think they'll fall into a couple later points that we're going to make. But right now, I wanted to move is really letting folks know we've talked a lot about technology in general, but when you talk about getting this implemented, how do health systems benefit from the combination of a Salesforce and an implementer such as Persistent? So Heidi, if we can move to the next slide. What we really is kind of to give an overview of what you may be looking for. You look for, and this dovetails into one question, is what systems are available? And we talk about Salesforce as being what I call an omnipresent platform. It's a broad ecosystem of, health information on the front end, gives you mobile capability. It gives you a solid core foundation platform. It gives you user interface. It gives you integration capabilities. And then what you're looking for is you're looking for providers like a Persistent that has a long history working with these solutions, in our case, over 12 years, but also the expertise to understand the client business and understand what is your processes, what are your needs, and where are you along that digital journey that Vinod was talking about, or how far along are your health processes, what Dr. Pandit was talking about. So this is kind of the summary of, our engagement with Salesforce and our engagement in the healthcare spaces. The question that we have here is, after this, is how do you get started? How do health systems get started? They're at a point, and all of them are probably at varying different points along that journey. So, Dr. Pandit, is there just a recommendation of what you may have as how these health systems get started?
Yeah, I mean, I think health systems, as a practicing physician myself, I know there's quite a bit on their plate at the moment. And you're trying to just make sure that you're prepared for the current stresses for meeting the needs of your patients around you. But stepping back and trying to leverage some of the offers that technology companies such as, of course, Persistent and Salesforce have offered, but others as well, just gathering information on what fits your needs. Because like Vinod very well put it, everyone's at a different stage. There are small health systems, large health systems, there's providers. The providers who are now payers who are now providers. There's it's such a heterogeneous mix that it's difficult to say there's one starting point for all. But I think stepping back and just saying, okay, we need some assistance in surveying where we are and importantly, what we need. and where we're headed, and what are the steps to get there. And it's okay to step back and say, we don't have that core competency within our system, and it's okay to step back and ask, because companies now in this space have a lot of lessons learned to share. And I think that's really important in this time, to learn from one another's experiences and improve on that. So that would be my one recommendation.
Yeah. So my perspective on that is basically, I would advise go for low-hanging fruit, where, you can take, slice of your process and try to kind of look at, how you can put this process or bring this process on digital channel. That is kind of, very good point to start, because you're very encouraged, looking at the outcome, and, some of the technology can be implemented literally in weeks. You don't have to even wait for months, right? So I would suggest that, pick process that is very need of the hour, where you need to extend that process on digital channel for your patients, whether it is engagement-related process or care-related process. So bring that process, as a kind of, start point in a way. The second point is basically, again, I will say, look at it from patient perspective rather than what you have. So that will give you perspective of what is the gap and what really patient wants, and how do you deploy this technology, for that purpose, and basically go from there. So I would suggest that, with so much going on in health system, it is always better to pick one process and one kind of goal, and then work towards that goal using what technology can do for you. And everything is kind of, I don't want to trivialize at the same time. A lot of things are getting easy, right? A lot of, technology is kind of making it easier for elements like integration, elements like learning from data, drawing those inferences and building interfaces for patient and experiences for patient, and not only patient, again, for provider and then rest of the support system within health system. All of these things are kind of, becoming easier to implement, and we should take kind of advantage of that situation. But I would suggest, instead of, starting kind of big bang, big initiative, I would take like smaller process, and then something that helps you connect with patient that you are not able to connect otherwise will be a kind of a good start, in terms of how do we get started, right? And then obviously all these features and elements that are there on the technology side will basically help you make decision what you can do now versus, next month and otherwise.
Yeah, if I can add on that, actually, that again, patient-centric, keeping your strategy with the patient in mind. A recent study I was just reading this morning, 75% of patients said they were very satisfied with their virtual care visit, but half of them said that they left visits not truly understanding what their next steps were. And I think that's the piece, again, coming back to that. I think Vinod touched on this eloquently. These are tools, but it's not a strategy. So there's a lot of things out there that can be stood up quickly, that can be used as a tool to deliver care in that point of care type manner, but this larger patient engagement that needs to be there to make this successful is what we really need to step back and pause and take a look at how we're going to accomplish. And that is the strategic part of it. But as he said, I mean, many systems have stood up solutions in a matter of days, which we just haven't been able to do in the past. And that is a starting point. But thinking about how the patient's going to perceive, consume, and participate in the tools, the care delivered via the tool is as important as getting the tool up and running.
Yeah, absolutely.
I think there's a question from Lakshmi that's related to this, and she's asking, is there a set of quality or quantitative metrics that health systems should be looking at when they're starting this journey? Is there, the old saying, 7 habits of highly effective people, right? Begin with the end in mind. So what kind of metrics or things do you think these health systems should be looking at? There's process and system metrics. And I'll let either one of you start on that one.
Go ahead, Dr. Pandit.
Yeah, I mean, I think I would just, there's probably a number of things we can use, but I don't know how relevant they are in today's world and how quickly things are changing. I don't know if there's a published set of metrics. I think patient satisfaction is a place to start, and patient responses, and again, their outcomes. And trying to figure out what works for the population you're serving, that would be a place where I would start. And as a physician, I would be very interested in that, actually, to see who, experiences these different methods of care delivery, more efficiently. I don't think it's a one-size-fits-all solution. And when thinking about the vulnerable populations, I think outcomes, disease outcomes, would be very important. Which is unusual to look at technology solutions in the setting of disease outcomes. But that's, as a physician, I kind of look that way. Vinod, what are your thoughts?
So from a tactical standpoint and more from operations standpoint, this is like, testing, if what you are doing is really working and what is the direction forward, right? So that's what, quality metrics will give you in terms of, understanding and inference from your initiative. So some of the KPIs and some of the metrics that you can use here, and I've seen health system track, is basically schedules, right? So how many schedules are we able to kind of fill out using these digital channels, right? And how busy your providers are, right? Delivering care. That is very good metrics to start with, because look at it from, other perspective, where you have most of the care team taking care of COVID patients, but at the same time, you're a specialist who would, work on a particular disease condition, and how much, I can take their time to deliver care. That is very good metrics in terms of, slots that are being filled out for provider for virtual care. That is very, very, trackable KPI, and learn from that KPI, right? So that is one thing. Second thing is, from technology standpoint, there are elements that you can provide to your patients in terms of self-triage. So you can also track, how many patients are opting for that, advisories. And that is another element where patients are kind of, opting for that kind of feature. So keeping track of those kind of features and utilization for those features when you add new digital channel for virtual care or engagement, those seem to be very, very, good KPIs. And then other part is, rather than KPI, but other aspect I wanted to mention was that, what it is that you are not able to do because you cannot bring patient in, which is kind of necessity at this point in time. That is like very obvious, right? So for some of the health system, urgent care is, most primary or most important element. So they would go after that kind of, and then track how many patients are really opting for video visit, and how many patients are showing up, how many patients are kind of, sending, messages to their providers and getting kind of a e-care, if you will, right? So you can track all these metrics to see, if you are heading in right direction, and do course correction, in terms of implementation. That's what I feel in terms of metrics.
Thank you both. I have two final questions that have come in, and actually I'm going to give one to each of you, and then that'll kind of wrap us up. We're rapidly coming to the end of the thing, so our time, and we appreciate all of the participants staying on and listening. So Vinod, quickly, first question has come in from Anand, is how long does a typical telehealth implementation take for persistent, or for providers or whatever, or for a partner to implement? Is there a standard time? Is there a non-standard time? How long does it generally take?
It really varies, because in some of the health systems we have seen, they have some technology or other, already established as a channel, right? So they're doing telehealth, televisits, that kind of engagement with the patient already, but it is on smaller scale, or not every department is adopted to that. So in that case, taking technology like Salesforce and integrating that with already existing telehealth channel is pretty quick. I don't want to it changes a little bit from scenario to scenario, but it won't be like as I said, more than I'd say a couple 3 months, right? The other element is if you don't have telehealth channel, then you need to bring in that kind of channel and integrate, and then go to specific department or a specific disease condition for implementation, and it will change from health system to health system. But in general, overall, I don't think it will take more than 3 months to implement telehealth kind of initiative.
And Dr. Pandit, I have one final question for you as well. As a physician, what do you see are the benefits of using telehealth with your CRM or your content management system?
Well, I think there's many, because you can meet the patient where they are in a timely manner in ways that we couldn't do if we were only, using traditional forms of interaction with our patients. I think from that you can glean in, improvements in prevention, chronic illness management, wellness, behavioral health, as we touched on before. I think these are all opportunities for the utilization of telehealth. But I think the larger solution here is the personalized end-to-end journey, allowing a patient to manage their journey from their perspective and be as dynamic as they need it to be. And I think that's the benefit.
We have 7 minutes left, but I have one final question. Telehealth here to stay?
Yes.
Simple, easy question. Is it going to become the new norm?
I think as I see it, it's something that's been around for a while. In our personal lives, we all use two-way video in so many different ways. In healthcare, it's new, but it really isn't a new concept. So I think it's just as people get more and more comfortable having those visits with their clinician and other providers in that medium, I think, it's going to be another medium in which we communicate with our patients as a part of the larger all the other channels that are now available. So I don't see telehealth necessarily going away. I do see an evolution of the larger care solution in the virtual space continuing to improve and get optimized, and we're going to find new ways to engage our patients. Again, right care at the right time in the right place. That concept of being personalized in our care delivery is where we need to continue to strive to get towards.
Yeah, absolutely agree with you. And that's, see, what happened is because of COVID, it became like a necessity, and now, health systems who were thinking telehealth is not for them are also, need this technology and solution. Now, however, in terms of evolution towards personalized and proactive care, and that's where the path I see, where it goes a little bit beyond just talking to provider to more like looking at data and then, really using that data to, proactively reach out to the patient. And I think it will start with, a little bit of low-hanging fruits again, like, you are due for a certain kind of checkups and those kind of things. So that's what, technology will be able to proactively do and remind patients. And then from there, I think it will slowly go into more chronic care kind of situation. And then from there, I believe it will reach to, some other treatment titration plans also. So I don't think it is going to stop, and I don't think it is just for COVID, but it will go a little bit beyond, and it is here to stay. And with all the environment that we discussed before about how, government and private, peers are encouraging health systems to adopt and go on this path. And in general, from patient perspective also, if you see, overall, like we talk about healthcare consumerization, where consumers, and they're not patient, but they're really consumers, and they want same kind of experience that they have with their OTT platform, for example, right? So really, everything is kind of teed up very nicely to expand on this journey, and then this will really, really evolve in my mind, right? And all this is like very right time to, go on that journey for the entire healthcare ecosystem, not just health systems.
So thank you. I wanted to thank you very much, both of you, for your time, your insights. Dr. Pandit, thank you so much. Vinod, thank you. And Heidi, I will turn it back over to you for any closing logistics.
Great, thank you so much. I'd like to thank our presenters for today, Dr. Sindhu Sindhu Pandit and Vinod Parale, our moderator, Dean Douglas, and Persistent Systems for sponsoring today's webinar. And finally, I would like to thank you all for attending. We sincerely appreciate your willingness to share your time with us. Stay safe and have a wonderful rest of your day. Thanks. Bye.